Hi everyone, welcome to the Gold Medal Caregiver channel. We're here to share practical caregiving tips so you can easily take care of elderly family members or patients at home. If you have a family member with respiratory problems, don't miss this video. We'll teach you how to properly care for them, improve their quality of life, and help them get better. Hello everyone. Today we're talking about respiratory care, specifically how to wean a patient off oxygen after short-term use in acute situations. This can be a big challenge for many families, but with the right approach, recovery can be smoother and more successful. I'll share some practical tips from professional caregivers, along with insights from traditional Chinese medicine and magnet therapy. Hopefully this will be helpful. Tip 1. Understand the condition and oxygen needs. First, you need to confirm the patient's condition with their doctor. Is it pneumonia, COPD, or another respiratory issue? Why are they using oxygen? Is their blood oxygen level dangerously low, typically below 90%, or is it just short-term breathlessness? Understanding these things will help you know when it's okay to start weaning them off oxygen. Professional caregivers monitor the pulse oximeter readings, SPO2. Normal levels are between 95 and 100. If the patient's SpO2 stays within this range while using oxygen, the doctor might suggest trying to reduce the amount. But never do this on your own. Always talk to the doctor first. Safety is key. Tip 2. Gradual oxygen reduction training. Weaning off oxygen doesn't happen overnight. It's a slow process, like a marathon, not a sprint. Professionally, we use a step-down approach. For example, if a patient is using 3 liters of oxygen per minute, you might reduce it to 2.5 liters and observe them for 30 minutes to an hour, checking their blood oxygen and breathing. If everything's okay, reduce it to 2 liters and so on, step by step. Keep a close eye on the pulse oximeter and watch for signs of shortness of breath, blue lips, or chest tightness. If the patient experiences any discomfort, immediately return the oxygen to the previous level and let them catch their breath before trying again. This process can take days or even weeks. Patience is super important. Tip 3. Combine with breathing exercises. Deep breathing. Have the patient sit upright, inhale slowly until their belly expands, hold for 3 to 5 seconds, and then exhale slowly. Repeat this 10 times daily. 3-ball spirometer. Have the patient use this little tool to inhale deeply, filling their lower abdomen. This increases their intake of air and helps expand their lungs. It's simple and effective. Diaphragmatic breathing. Teach the patient to breathe using their diaphragm, not just their chest. This allows oxygen to penetrate deeper into the lungs. These exercises can be done with oxygen initially. Once their condition is stable, they can practice without it. Keep sessions short, 5 to 10 minutes, to avoid fatigue. Tip 4. Adjust the environment and posture. In terms of posture, sitting is better than lying down. Have the patient sit up, supported by pillows, with relaxed shoulders. This helps their lungs expand more fully. If they must lie down, elevate the head of the bed to 30 to 45 degrees to reduce pressure on the lungs. These small adjustments can make breathing easier and weaning off oxygen smoother. Tip 5. Traditional Chinese medicine for respiratory health. Dietary therapy. Prepare simple herbal remedies like pear stewed with chuan bei, which clears the lungs and moistens dryness, or lily and goji berry porridge, which nourishes lung qi and is easy to digest. These are gentle and suitable for respiratory patients. Avoid hot and dry foods like chili peppers and fried foods, which can worsen lung conditions. Acupressure. Regularly massage certain acupoints that benefit the lungs, such as faishu on the back, below the shoulder blades, tai yuan on the inner wrist where the pulse is, and hegu between the thumb and index finger. Gently massage these points for 5 to 10 minutes daily to promote circulation and enhance lung function. Use gentle pressure, it should feel comfortable. These methods are gentle and can gradually restore lung energy. They work well in conjunction with oxygen weaning training. However, if the patient has other chronic conditions, consult with a traditional Chinese medicine practitioner first to ensure it's safe. Tip 6. Magnet therapy as a supplementary treatment. How to use it. I often apply small magnets. Food-grade magnets are safe and have no side effects to acupoints like Faishu, Shanzhong, center of the chest, and Taiwan. Leave them on all day and remove them after a few days when you feel improvement. Effects. Some patients I've cared for have experienced stabilized blood oxygen levels, reduced shortness of breath, and even improved lung capacity after using magnets. It's not a magic bullet, but as a supplementary treatment, it can make weaning off oxygen easier. This method is non-invasive, as the magnets are simply placed on the skin. Families usually don't object, and hospital staff don't oppose it either, as they've seen ads for magnet therapy. If you want to try it, remember to observe closely and stop if there's any discomfort. Tip 7. Observe and record. Professional caregivers place great emphasis on observation, and you should too. Be a meticulous detective. Record the patient's blood oxygen level, respiratory rate, normal is 12 to 20 breaths per minute, and how they're feeling each day. Are they experiencing severe shortness of breath? Are they feeling weak or tired? Share this information with the doctor to adjust the training plan. Observation and recording are especially important in the later stages when the patient is weaning off oxygen and starting independent exercises. Record every exercise session, heart rate and blood oxygen before exercise, duration and intensity of exercise, and how long it takes for breathing to return to normal after exercise. This helps track the patient's progress and determine their readiness to come off oxygen. Tip 8. Don't forget emotional support. Weaning off oxygen is not just physical. Mindset plays a crucial role. Some patients panic when oxygen is removed, feeling like they can't breathe. Offer encouragement, show them their progress, and reassure them with phrases like, "You've made so much progress," or "We'll take it slow, no rush, don't worry." Use distraction techniques. Chat with the patient, play calming music, and help them relax. A calm mind leads to easier breathing. This is a very effective technique in professional care. When the patient feels secure, recovery is faster. To summarize, helping a respiratory patient wean off oxygen involves a gradual approach, breathing exercises, environmental adjustments, emotional support, and supplementary treatments like traditional Chinese medicine and magnet therapy. Every individual is different, so avoid blindly copying other people's methods. Always work with the doctor and tailor the approach to the patient's specific needs. The process can be lengthy, but with patience and persistence, many people can successfully wean off oxygen and restore normal breathing. A final reminder, if during training the patient suddenly experiences severe shortness of breath, their blood oxygen drops below 85%, or anything seems unusual, stop immediately and restore oxygen supply. Safety first. Progress, however slow, is still progress. If you found this video helpful, please subscribe, like and share and turn on notifications. Thank you.